Today, December 1st, is World AIDS Day. What is World AIDS Day and what can you do? What is HIV and AIDS and how can you keep yourself and your loved ones safe from this awful disease? Find out more this week on the Blue Ball Report. Welcome to the Blue Ball Report. I'm your host, Superfvck, the queer, super sexy hero who was sent to Earth aboard an intergalactic ejaculate from the planet Gonad to liberate libidos and thwart coitus lamus. Funny lingus, blowjobs that blow, sexual oppression, repression, suppression, or depression. I'm the superhero for the job. To call on my services, just point and hold your middle finger towards the sky. And remember, kids, lick it before you stick it. Cling! This week's episode is coming to you one day sooner this week to coincide with December 1st, the annual World AIDS Day, which is a day to bring attention to and call action to the end of the HIV epidemic, spread awareness and information, and speak out against HIV stigma. I want to first start with a moment of remembrance to all of those that we have lost to this disease. And I also want to send out gratitude to all of our ancestors who fought hard for us to be able to live today safe from this disease. Because fortunately now we have a solid understanding of AIDS and HIV, and we also have highly effective medicines and strategies that can keep you safe and healthy. A YouTube channel about sex and love would be incomplete without information about sexually transmitted infections, or STIs. And to honor this day and your health, we'll continue with a comprehensive overview and update about what this disease is and how to keep yourself safe from it, as well as why and how we can stop the stigma of HIV. See the description to skip straight to specific topics and to see any corrections or updates to the material here. Let's start with the basics. HIV, or human immunodeficiency virus, is a sexually transmitted virus. If untreated, having HIV can lead to a deadly disease called AIDS, or autoimmune deficiency syndrome. This disease cripples the body's natural defense system, leaving it vulnerable to other diseases and death. But luckily, there is treatment for those who are infected with HIV to prevent them from developing AIDS. But it's expensive, lifelong, sometimes complicated, and sometimes unpleasant side effects. So it's really best just to avoid catching this thing. HIV is transmitted by body fluids like blood, semen, pre-cum, vaginal fluids, rectal fluids, breast milk. But it's not found in saliva, snot, or tears. While everyone is at risk, highest risk of infection is amongst men who have sex with men and injection drug users. But first, let's start with some basic vocabulary. HIV positive describes people who are tested positive for HIV. That is, they're infected with the virus. HIV negative describes people whose result was negative for the HIV test. A person can be infected by HIV and then it can take a 3 to 6 months window period to actually show up in the test. This means an HIV negative result means the person was negative as of 3 to 6 months before the test, but they could have caught HIV since then. There is a less common HIV test called the RNA test that has a shorter window period of only about 10 days. If you get tested, ask your provider about the window period. Seroconversion, or to seroconvert, is when an HIV negative person is infected with the virus and they become HIV positive. This is often marked with temporary flu-like symptoms. Currently, the seroconversion cannot be reversed. An HIV positive person cannot be changed back to HIV negative. But just because you're exposed to the virus does not necessarily mean you will seroconvert. Sometimes that just doesn't happen. Viral load. This is a measure of how many copies of the HIV virus are in the bloodstream, done by medical tests. The lower, the better. Meds. This refers to medication prescribed to HIV positive people to control and minimize their viral load. Meds also prevent AIDS from developing in HIV positive people. HIV infection used to be a certain death sentence, but modern meds make it a manageable condition, undetectable. This is when the viral load of an HIV-positive person is so low that tests cannot detect it, nor can they transmit the virus to others, which is a part of protection. Using a condom and/or HIV medication such as PEP or PrEP is a way to protect yourself from seroconverting or becoming HIV positive. Treatment as prevention, or U equals U, is undetectable equals untransmittable. And this is another type of protection where the HIV positive partner is adhering to a treatment regimen that keeps their viral load at undetectable, so their HIV is untransmittable. Now, let's look at the risk of HIV transmission by sex type. See link to the CDC in the description as a reference. At the highest risk of transmission is receptive anal intercourse. This is uptight blue baller speak for getting your ass rammed, your pink pucker plowed, even higher with cum in your bum. But pre-cum is also contagious. Also at the high risk level is the insertive anal position, sometimes known as the top position. Back and fudge. Slithering your snake up the poop chute. Man ramming the bro hole. Also high risk is receptive vaginal sex. Getting your pussy plowed is high risk. Even pre-cum is infectious. At medium risk is insertive vaginal sex, aka putting your dick in a box, cramming the clam, stuffing the snatch, wiener in the taco, popping the puss. At low to no risk, there are extremely rare cases of transmission by kissing, which would require blood in the mouth that would have to reach an open wound in the other person's mouth. Also at low to no risk of transmission is analingus and oral sex. This is eating ass, tossing salad, fellatio, cunnilingus, sucking cock, rug bunching, slurping the slit, muff diving, sword soloing, riding the mustache, hosting a salad bar, tongue punching the fart box, Hershey kissing the Hershey hole. Disease and risk of disease is a fact of life, but blue ballers need not despair. Accurate information and precautionary measures can significantly reduce your risk of infection, so let's get down to it. But first, if you like laughing and learning to empower your Eros for making love transcendent, then hit the subscribe button for weekly content. Ways to reduce your risk of HIV infection and AIDS. First, get tested regularly to know your status, every 3 to 6 months if you're higher risk, less often if you're not. If you're HIV positive, it's better to consider treatment options sooner than later. Find a non-judgmental medical professional that you can be completely honest with. 2. Don't share needles. Buy fresh needles from the pharmacy or find a needle exchange. Regarding sex, the safest is to skip sex altogether. Boring. Or you can make and follow your own safer sex plan. Decide the sex and risk you are willing to take and stick with it. Make a contingency plan for mishaps. Do this now while sober, removed from a sexual situation. Sex is an intoxicant and often impairs our judgment. Here's some options to consider. Number 1, use condom consistently and correctly. These protect against STIs and pregnancy. Carry your own condoms so you can be sure they haven't expired and that they've been stored safely. Don't store them in your wallet where they'll break down sooner. Learn proper condom use. Wrap it up, bud. I'll link to a video about proper use here. Number 2, consider HIV medications such as Truvada prescribed as PEP or PrEP, especially if condoms don't work for you or if they break. First, we'll look at PrEP, which is pre-exposure prophylaxis. PrEP is a daily anti-HIV medication for HIV-negative people that is highly effective in preventing HIV infection, but has side effects in some. Be warned though, you're still at risk for pregnancy or other STIs like gonorrhea, chlamydia, or herpes. PrEP is often covered by health insurance or offered free of charge by programs in some areas like San Francisco. Your doctor can prescribe it or you can get an online prescription. I'll put links in the description. If you're not on PrEP and you're potentially exposed to HIV via sex or needles, you can start PEP or post-exposure prophylaxis to prevent seroconversion. PEP is 1 month of HIV medications such as Truvada. It's more effective the sooner it's started, and you must start medication within 72 hours of exposure. To get PEP, talk to your doctor. Use their on-call services if the office is closed because urgency is key. You can also go to an urgent care facility or an emergency room, ER, to get PEP, but these can be considerably more expensive. Online services such as plushcare.com could help you with PEP and be thousands of dollars cheaper than going to an ER. If your doctor isn't familiar with PEP, then get a new doctor already. They should know about this. If you need to educate them, links and phone numbers are provided in the description of this video. Also, learn how to effectively communicate with your partners about STIs. Remember, have this conversation as soon as appropriate and possible. Don't wait until you're already fucking or just about to. HIV is highly stigmatized, so questions like, "Are you clean?" are rude. They imply that having HIV makes someone dirty. Instead, you should ask, do you know your status? When was the last time you got tested? The stigma about HIV makes it hard for some people to be honest, especially if you speak in a way that is slut-shaming or shames HIV. And it doesn't take a slut to catch HIV. You can catch it from one instance. Also, don't assume that anyone is HIV negative for any reason. For example, because they seem nice or trustworthy. There are a lot of nice and trustworthy HIV positive people and a lot of untrustworthy HIV negative people. This is, once again, a stigma. Also, don't expect anyone to offer their HIV status unprompted, whether they're positive or negative, even if that's the law. If you want to know, then it's your job to ask. But remember, someone who has recently tested for HIV negative may actually not know that they're actually HIV positive because they may have seroconverted during the window period or since their last test. And unfortunately, a newly infected person that hasn't started medication, they usually have the highest viral loads, making them the most contagious and dangerous to affect you. Also, a partner who is negative on PrEP may have missed doses and they may be infected. So you may want to ask, how often do you miss a dose? When was your last test? U equals U. An undetectable HIV positive person has a viral load so low that it is untransmittable. And there's evidence for this. I'll leave a link in the description below. This is what treatment as prevention means. But they may have missed meds since their last undetectable test result, leaving them currently infectious. You might ask an HIV positive person, are you on meds? How often do you miss a dose? When was your last viral load test and what was it? The point is, it can be very difficult to know exactly how contagious a partner may be. Regardless of what a partner tells you, the best approach is to take responsibility for the risk you assume with your choices. Use condoms and/or PEP yourself to protect yourself. Choose sex acts with risks you are comfortable. Take control of your own safety, and then your life won't have to depend on other people's viral counts, behaviors, memory, honesty, or adherence to a medication regime. Sex will always have the risk of pregnancy and/or disease. It always has. Safer choices can reduce your risk, but blaming and stigmatizing others only stifles honest communication. So take care of yourself. Keep informed and manage your own risk and choices and encourage others to do the same. I'm curious about your ideas to stay safe from HIV. Please add them in the comments below. If you have friends who would benefit from the information in this episode, see the description for links on social media to share it with them very easily. For more videos, click on this playlist, which will also be linked in the description. Until next time, fuck well and fuck safe.